I'm Iyawnna. I'm a rising senior at UC Berkeley studying integrated biology with a minor in African American studies. This summer I had the pleasure of being an intern for Health Career Connections. I was placed in the organization called Alameda County Health Pipeline Partnership, or ACHPP for short, and basically it's an umbrella organization for various and different pathway programs that diversify the healthcare system by providing mentorship, professional development, career exposure, all these other things for diverse youth. The executive director for ACHPP is Dr. Garrick. She is not only the executive director of ACHPP, but she's also the president of MIMS, or Mentoring Medicine, which is another pathway or pipeline program for diverse youth. She's an MD at Highland Hospital. She's amazing, basically. So I had the pleasure of working with some amazing people during this internship. For example, Sequoia Hall, who is the program manager for ACHPP. She just brought this light and positive energy to this internship. Brian Van, who is the program coordinator, showcased his ability to be multifaceted, and is very inspiring to me. So underneath ACHPP, there's a program called HCC, or Healthcare Services Agency. Underneath HCC, there's 4 branches of departments. So there's administration / indigent health, there's public health, behavioral health, and environmental health. So specifically, I had the opportunity of being an intern for the HCC 2017 Career Summer Exploration Internship for high school students. So this internship basically took in 30 high school students from Oakland Unified School District, coming from diverse backgrounds who were considered to be underserved, and provided them with internships within each different field. They were placed in either one of those departments to get that type of career exposure. I had the opportunity of working with 4 other college interns, Afyoung, who's also an HCC intern, Kate, and Andrew. What me and the other college interns did was assist, support, and mentor the high school students. We helped organize workshops, do icebreakers, do presentations, and conduct and manage field trips that the high school students went on. Not only did the high school students get placed in a certain department, which gave them career exposure to different fields in the healthcare system, but us college students had the opportunity as well. I had the opportunity of working in the Alameda County Health Coach Program. What the Health Coach Program does is provide resources and services for those patients that undergo and have hypertension and diabetes so that they can better management. We provide education about nutrition, hypertension, diabetes. We get them connected to resources, so whether that is diabetes management classes, medical insurance, a primary care doctor, pharmacy, and a medical home, so that they can better manage their chronic illness. Within the Health Coach Program, I underwent a lot of trainings that informed me or refined my knowledge on nutrition, hypertension, diabetes, dieting, exercising, as well as the behind the scenes of the healthcare system that no one talks about. So for example, the social determinants of health. Take for example a person who has a low income, which is one of the social determinants of health. And because of their income, they have to live in a location that maybe doesn't have access to a grocery store. If there is a grocery store, it's 20 to 30 miles away. And because it's so far, they resort to eating the food that is closest near them, which might be the McDonald's or Burger King next door, which then causes them to have all these other health issues. Just because they don't have a sufficient enough income, then their health is affected. And that just showcases how our healthcare system needs so much more help than what's on the surface level. I also got the opportunity to work with Jorge, who was the health coach trainer and also an HCC alumnus, and influenced me to look deeper and not just the surface level of the healthcare system. Some of the projects that I worked on when I was in the health coach program include creating 2 large posters of all our health coaches to showcase the diverse background that they have, and they actually match the county of Alameda, which therefore makes better connections to their patients. Those 2 posters will be placed in Highland Hospital. In addition to that, I created a flow chart about the health coach program for training purposes. I called patients who successfully graduated the health coach program or a portion of it and completed exit interviews in order to evaluate and improve the program for the future. And I got to work with one of the high school interns, Fatima, who was just as driven to help people as I was. Our findings were then presented to our staff meeting and then later on a research meeting at Highland Hospital. I also got to practice what I learned and was an actual health coach for the emergency department at Highland Hospital and enrolled patients into our study. And lastly, I created a video about the health coach program in order to bring awareness that will be posted on the website and then presented during grant meetings. And that's it. So I actually want to thank HCC for allowing me this opportunity to intern for Alameda County Health Pipeline Partnership. It allowed me to get all of this career exposure and refined my decision and mentality on serving disadvantaged youth. Thank you.